Good afternoon, everybody, and welcome to today's 715 Health Check webinar. My name is Samantha, and I will be your host this afternoon. Okay, before we start, I would like to make an acknowledgement of country. We recognise the traditional custodians of the land and sea on which we live and work, and we pay our respects to elders past, present, and emerging. Okay, so these are your learning outcomes for today, which Tim can take you over, but I will just introduce you to our presenters and then maybe we can come back to those learning outcomes. So today we are joined by Dr. Tim Senior, Miss Christine Carriage and Mr. Lee Bradfield. So Tim works as a GP at the Aboriginal Community Controlled Health Service in southwestern Sydney and holds clinical lecturer positions at Western Sydney University and Sydney University. He is a medical advisor of the ACCHS Aboriginal and Torres Strait Islander Health and chair of the Environmental Impacts in General Practice Network in the ACCHS NFSI group. He writes on general practice, the social causes of ill health, and successfully crowdfunded Wonky Health, a column on the Croaky Health website on the health effects of policy decisions. He won the Gavin Mooney Memorial Essay Prize for an article on the language used in climate change campaigning. So welcome, Tim. And also to Christine Carriage. Chris is an Indigenous Program Officer at the School of Medicine at the University of Western Sydney, and Mr. Lee Bradfield. Lee is a Manager of Public Health at the Aboriginal Health and Medical Research Council. So thank you, Tim, Chris and Lee for joining us. I might flick back to our learning outcomes now, Tim, and you can go over them quickly.
Thank you very much, Sammy. I will go over them quickly. That's much longer than the biography I was expecting. Lovely to be joining you at lunchtime today. Chris and I join you from Darawal land, where we both live and spend most of our working lives. And I think Lee is on Gadigal land, the Eora Nation in Sydney. Am I right, Lee?
Yes, that's correct. Thank you very much.
Excellent. So I'm aware of all that there's probably many different countries that many of you are joining us from. So today we're going to concentrate on Aboriginal health assessments, and by the end of this webinar we'll understand the components of an effective health assessment for Aboriginal and Torres Strait Islander people. We'll be able to describe how members of the teams we work in contribute to effective health assessments, and we'll be able to identify strategies to improve health assessments in our own services. So we'll move on past the presenter slides and onto the so now this slide reminds us, for mainstream practices, the college, we've actually produced this series of 5 steps that help mainstream practices provide excellent Aboriginal and Torres Strait Islander healthcare. This is a bit like teaching an Aboriginal medical service to suck eggs, I think. One of the components of this is a good Aboriginal health assessment. The next slide shows us what those 5 steps are, and you'll see, and really this is just to demonstrate that an Aboriginal health assessment is part of is not the sole component, but is part of providing excellent primary care. Aboriginal medical services are already across all of those sorts of things as part of their routine practice, so we're not going to concentrate on the 5 steps, but we're going to concentrate on making Aboriginal health assessments as useful as they can possibly be for our patients and for ourselves. I guess it's worth mentioning, I'm a GP, so I tend to use the word patients. There is a bit of debate about that. I know many of the services that we work in also use the word clients, so you'll probably hear those 2 terms used somewhat interchangeably, and and this webinar is not really the place to get into a debate about which one we're going to use. And the next slide is what us GPs tend to call social and cultural determinants of health. And this is a reminder that when people come into us for a health assessment or for healthcare that we're providing, they're coming from a particular context, and we're sending them back into that particular context that has profound impacts on their health and isn't just about the diseases that they have. And so the employment and income, people's ability to eat healthy food, food security, people's experience of racism, the early childhood development and education, and even trauma in early childhood, what people's housing is like, their interactions with government bodies and institutions, either now or in the past, and that would also include hospitals and health services and independent organisations, experiences in the criminal justice system, and the circumstances that make people make particular choices about their health. Chris, is there anything particular you'd say about that context?
Sorry, just thinking about it actually. I think that as Tim said, you're working in AMS, so you understand how the context of this works towards people's good health, health and well-being as a whole. And I think on the next slide's around that sort of like relationships that you have with people that you actually develop with that. Sorry, Tim, but yeah.
That's right. So that will come up. So the next slide. As you all know, the Aboriginal and Torres Strait Islander Health Assessment is MBS item 715, and it's designed to be a systematic review of an Aboriginal or Torres Strait Islander person's health. That's the monetary claim for it. There's several reasons for doing them. One is that all our services and the PHNs that we work in are measured by the number of Aboriginal health assessments that they're done. It's a good income revenue generator for services, and so there's circumstances to do that, and it allows access to people to have their allied health that they wouldn't have access to if they don't have a chronic disease, and it allows additional allied health if they do have a chronic disease. We'll go into that a little bit later. Medicare divides them up into children, adult and older person, but the item number is the same and the payment is the same. We have got a few people asking if they'll get a copy of the presentation. I think we're quite happy to give this out afterwards. It's very difficult to get excited about Medicare, I think. When I'm teaching about medicine, Medicare is always the topic that you want to get drawn into least. Obviously, Medicare sets criteria about what you actually have to do the billing, and that's a sort of summary of what the criteria are at the moment. And you can go and look at the MBS online website for the criteria that you must meet in order to bill it, and also the guidance around doing that. From a community perspective, people tend to know about health assessments. We'll be hearing from Lee shortly about raising awareness of health assessments in communities, but they're not that fussed about Medicare, are they?
No. They're more likely to come back because of the relationship that you develop with your patients. They're also more likely to be, they'll invest in that sort of thing into you as part of you invest in them in their way that they look at their health. I think that if you start portraying that sort of thing around that they're just a number and that it's just about Medicare, you'll probably find that you might lose them. And I think that's the point around AMSs, and I'm sure you all have wonderful relationships with your clientele. I think that building that relationship to do that health assessment, all of that follow up around the health system as well, which I think is really important.
Absolutely.
Yeah.
We'll go into that in more detail soon as well. And in the 5 steps, the importance of follow-up is stressed. And so as I was saying, Aboriginal and Torres Strait Islander Health Assessment opens up access to 5 allied health visits, which are in addition to the GP management plan visits. The evidence around, sorry, Chris, you were going to say.
I was just to say, I think you guys are in a much more better position because the relationship that your Aboriginal health workers would have with their clientele as well would help to actually support that healthcare delivery to your communities. I think that's the brilliant or the beautiful thing of working in Aboriginal medical service because of those relationships that the community staff have with your patients.
Yeah, absolutely. And I think the evidence on how effective Aboriginal health assessments are is not that strong. And the only way that they can work, given that there's a lot of pressure to do them and they do generate extra services for patients, and they do generate revenue for us, the only way they can work is by identifying problems and then having those followed up. If a health assessment isn't followed up, it's not really done anything. And they're often, particularly for patients new to a service, they're really good opportunities to build rapport and build trust, and say, look, we're a service that you can trust. You're going to get some benefit from coming here. You're going to get some benefit from having a health assessment. And that effective two-way communication is going to be absolutely fundamental and necessary if health assessments are going to be remotely useful for people. Again, this is the Medicare technical side of follow-up. So the on the next, if you move on to the next slide, here we go. That was the slide I was just talking about before. If we move on to the next one after that. So this is the Medicare view of follow-up. One of the things, once a health assessment's been billed, practice nurses and Aboriginal health workers can bill at 10987 for follow-up items. So education and associated monitoring of some of the issues that have been found in the health assessment. And so that can be really useful just in terms of funding some of the broader team care that happens as a result of a health assessment, and particularly important in Aboriginal medical services, where we know that patients coming to the service see more health professionals at each visit, and this allows Medicare to fund some of that. And as Chris was saying, you might want to expand a bit more. The role of Aboriginal health workers is really important. I know patients will tell things to health workers in my service that they won't tell to me.
Yeah, exactly. And I think that the health workers understand like those community dynamics and the way that, you know, people interact with each other, and they're more likely to get a person back into a clinic knowing that there is something wrong with them, or they need a health checkup and things like that. I know that I get hounded by my local AMS quite often because the worst takes me out. So yeah, and I think that's the beauty, as I said before, it's the beauty of you're working in this space that's, you know, has this support mechanism behind you as doctors, as practitioners.
So we're going to go into a bit more of the detail shortly about effective health checks and some of the research that tells us what communities view as being important about health checks. And before we do that, we'll move on to asking Lee to tell us about the ACCHS and their projects about Your Health, Your Future, which I hope is going to support the effectiveness of health checks that we're able to offer in our communities. Over to you, Lee. Thank you very much.
Thank you, Tim and Christine. Good afternoon, everybody. And I'd just like to pay my respects to elders past and present and acknowledge all the amazing work that you all do individually with our Aboriginal and Torres Strait Islander communities. I know that it's very rewarding work, and we're very lucky to have our member services, all 46 of them have amazing medical and nursing fraternity and Aboriginal health workers who work alongside our community members. We saw a need here at the Aboriginal Health and Medical Research Council for us to have a health promotion program that looked at some of the complexities and needs of our Aboriginal medical services, and we designed and put a lot of thought processes around the importance of the Aboriginal health assessment, the 715 Medicare item number, and we came up with the program Your Health, Your Future. So just going to the next slide, the objectives of Your Health, Your Future, we want to increase awareness and the acceptance of the 715 health assessment in the Aboriginal communities across New South Wales. Now, there's some discussion about where these should happen, who should do them. There's complexities around where they're getting done, and the actual information and the knowledge and the importance of why these health assessments should be done, in my opinion, with a service that can actually provide follow-up care very strongly. So to me, it would make sense that the majority of our Aboriginal medical services should be championing the 715 health assessment. We also want to strengthen CQI approaches to the delivery of the 715 in the ACCHS sector. I mean, we really want to highlight some of our member services who are doing amazing work in this space already. They're already doing quality work, they're already doing quality assessments, and we want to be able to get information from our collaborators who are working with us on this particular health promotion project, and involve them in being able to give us appropriate feedback about what they're doing well and how they're travelling with the 715 and how they're promoting them, and what kind of complexities and scenarios that they might find that they're having with having first of all the discussion with the actual patient or client in the Aboriginal medical services. We want to ensure that the New South Wales ACCHS have the appropriate tools, resources, training and support to be able to complete these 715 assessments and to be able to provide appropriate follow-up care. Now, we're seeing lots of Aboriginal health assessments being done outside of Aboriginal medical services, and they're not being able to access follow-up care through chronic care planning, advanced care planning, allied health care planning. So, and that's because they are having their Aboriginal health assessment done maybe at a local GP, and the local GP is signing off for them, maybe having a 15-minute consultation and signing off a 715 health assessment, which, you know, is might not be the best use of that particular health assessment. And we need to, you know, there are some GPs out there who are doing amazing work and they're doing fantastic assessments, and we really want to learn from those GPs, but there might be GPs out there who might not know how to navigate the 715 health assessment as well as those other people who are champions and the ones that are in our Aboriginal medical services. So we need to be able to learn at them, and this is what the CQI sort of approach looks at, about how we can learn from quality. And maybe get their input as well. And they might be struggling too. There might be scenarios in Aboriginal medical communities or in Aboriginal communities where they don't have a lot of access to appropriate care, and they might only be able to access a GP locally or rurally or something like that. And there's lots of complexities about having Aboriginal people go to an Aboriginal medical service, so they may prefer to go to a GP, but how can we support that GP in follow-up care? So, you know, it's not a it's so complicated. So we want to be able to offer assistance and help and learn both ways, from the Aboriginal medical services point of view, but also from the GP's point of view, because they really are very important to Aboriginal health. We also want to identify quality indicators that demonstrate increasing numbers of Aboriginal people in New South Wales having an actual completed 715 health assessment in the sector. So we want to be able to look at a program and in a method so that when an Aboriginal patient comes to, for example, let's talk about the ACCHS sector, because that's where I work in strongly. The ACCHS sector, if they come to an Aboriginal medical service, you know, we want from the moment that they walk through the door for the staff at the front desk to talk to them about the 715 health assessment. See whether or not they're eligible. They can look on PRODA, for example, have a look at the database and have a look at different systems to see whether or not they're eligible to have a 715 health assessment. Talk to them about, you know, what is their health priority today, and do you think that they can have time for them to sit actually and have a session with an Aboriginal health worker, and then see one of the clinicians, and then see the doctor as well. So we actually have quite a lot of AMSs who are championing this method already, and they do a wonderful job. In the Your Health, Your Future collaborative that we have through the Aboriginal Health and Medical Research Council, we currently have 18 of our Aboriginal medical services participating in the collaborative. So we've got quite a lot of really strong Aboriginal medical services working on their own focused project that they want to do in their community and in their own AMS. So they're quite dynamic and they're quite different. And some people might want to talk about influenza. Some people might want to talk about exercise. Some people might want to talk about diabetes. So we've got different types of priorities in different communities where we're getting traction around having these conversations with the community members around 715 health assessment. And we're providing funding for our AMSs who are part of the collaborative for them to be able to run their own programs and their own projects. If we go to the next slide, what we can see is that we want your health in your future to work in partnership with our member services to help build health promotion and the capacity at a service and a regional level. We will be meeting very soon here at the Aboriginal Health and Medical Research Council. We will be discussing our regions, and that will influence, how we, continue to work closely in our regions and having a look at what our regions need. Under the Your Health, Your Future collaboration, we will be, like I said, providing assistance. We'll be working in marketing, merchandising, helping out at community events, looking at an ambassador and a champions program. We've done some branding and some merchandising as well. And what we're doing is we are having a phased approach. So we're currently in phase 1, and that's really about introducing the program, getting the people involved in the collaborative, having these early discussions about what they need and what they see in the community, how we can talk to them about health assessments and what that looks like. And then if we just go to the next slide, we basically we want to talk about the ambassador program that we've got. At the moment, we've got 2 ambassadors. We've got Tyson Demos, who's the youth ambassador for the Illawarra Hawks, and he is the president of the Australian Indigenous Basketball League, and he's a Wollongong lad, and he's doing a 10-week youth engagement program. We want to use that program to send out a message about your health, your future, and basically also championing the Aboriginal health assessment through all of these different programs that he runs within this 10-week program. And also, we've got the deadly ninja, Jack Wilson, who's been engaged to work directly with, it says without member services, it should say with member services at a regional level. And Jack was at the Kooroo Knockout on the weekend, and he is a champion at talking to young people around their health, around health and exercise, around healthy eating, healthy living. And, he really is a good role model, and there's plenty of examples where he takes kids on a journey to think about changing how they think about themselves and their, their self-esteem and their appearance and how they look and how they eat and how they, championing things like going to school and learning and stuff like that. So we've got 2 really good and male ambassadors. We're looking to get a female ambassador too, so that we can make sure that our lovely young women and young girls and elder mothers are involved in our ambassador program as well, because we know that women are very important in our Aboriginal communities and helping change. So we really have got the ambassador program is running out across the state now, so we will be able to open up visits from Jack Wilson through our regional approach. And also with Tyson Demos, who will be working on a sort of like a calendar of his engagement. So we'll be able to actually let people know in our sector about what that looks like and how we can get the 2 of them to come and visit our Aboriginal medical services locally. Then we just go to the next slide. This is just some examples of some of our merchandise, which we've had quite a lot of traction on. We're doing things like, step up for a checkup. We're doing some really basic sort of images around pregnancy and young and youth. We've done some great shirts and some little baby jumpsuits and some water bottles, and there's also hats and things like that. We recently went to the Illawarra Shoalhaven, and we found that the kids really enjoyed little sporting resources. So we've got a whole heap of sporting resources on their way. So they were very popular, and they were just about engaging children to be able to participate in sport and exercise, and it was a fantastic experience for us. I want to say that when we're talking about Aboriginal communities and we say things like, low income, I really think we need to start using the word poverty. I think that there is much more strength in using strong language rather than using sort of light language around, so low socioeconomic communities. I think that we need to start using words that actually have an impact on people who are not really thinking about our space. So I just wanted to congratulate everybody and also say thanks. Kate Armstrong's in the room as well, and I know that Kate is amazing at championing some things, and we're very proud to be working with you guys on some of our projects. So that's enough. That's enough from me.
Thank you very much, Lee. It's not quite enough. I've got a question come through. Just wondering if other states have similar programs to this.
Actually, there are some other states. There are other programs that walk around, look at concentrating on the 715. Actually, Western Australia does have one, and I was actually just talking to a cousin of mine who has a focus on the 715 health assessment. So they do other programs that have got different names, but there is other things like, I don't even want to say the word, but there are other 715 programs run from other states, one in Queensland in particular, which I'm not going to mention the name because I'd much rather think about promoting your health, your future. But yes, they absolutely do. There are actually other programs that do similar work in this space, and but the New South Wales Aboriginal Health Medical Research Council with their service members want to work a bit more intensely as well. So it's a great opportunity for us.
Thank you very much. I think if you are wondering about what may be going on in other states, the NACCHO state peak bodies would be the people to contact about that. Each state has and territory has a peak body that community controlled members are members of, and they all do amazing work in each state and then NACCHO nationally. I've got my Your Health, Your Future t-shirt, and we often all wear them at Tarawal. If I had, yeah, Chris is saying she wants one, so one in the post for Chris, please. If I had children who went to, excellent. If I had children who went to high school, they'd be wearing those baby clothes as well. So the next slide, this is a reminder. So we published late last year a partnership between NACCHO, the National Aboriginal Community Control Health Organisation, and the RACGP, the National Guide to Preventive Health Assessment for Aboriginal and Torres Strait Islander people, third edition. So that's the updated version, which is, for those of you not familiar with it, is the guideline on preventive health in Aboriginal and Torres Strait Islander health. So it's like an Aboriginal version of the Red Book that the college produces, so that we know which interventions are most effective and recommended that have good outcomes in health assessment. And one of the important things about this is that the Medicare sets out their criteria for being able to bill, but this is the guideline, the clinical guideline around what preventive interventions are recommended, particularly across different age groups. So if you're not familiar with that, it's available from the college website as a PDF for free, and most services, I think, all got copies in the mail. Now, as part of implementing the national guide, so it's not just a guideline that sits on the shelf, the college and NACCHO are also funded after the publication of that to work out how it can be implemented and how it can be and how health assessments can become effective. And so as part of that, we did work with Aboriginal medical services and mainstream practices and held a round table with sort of key informants about what happens and what could happen, and also with software vendors. So that project's just finished. So we feel that as a result of that, we've learned quite a bit about some of the things that are required for effective health assessments. And one of the common things that came out was that patients often don't feel that the health assessment's useful to them. It's something that's been done to them rather than something that they've been a part of, and that actually feeling that it's useful is a really crucial thing. As Chris keeps saying, the importance of developing rapport and trust is absolutely crucial. Follow-up is crucial, and all of that is supported by effective clinical information systems and effective practice systems such as registers and recall systems, and a sort of a team approach. Is there anything you'd highlight about that, Chris?
No, I think you just highlighted that thing around rapport and trust, I think. And I think, yeah, that stuff around to them, not with them, is something that I think people need to be mindful of.
Yeah. We found that possibly some of the really helpful questions to ask people is, so you're here for a health assessment, what would you like to get out of this health assessment? Is there anything that you're particularly worried about? And then the other really important things are not just focusing, not just taking what we call a deficit approach, but what are people's strengths? What are the things they love to do? What are the things that they get up for in the morning? Who are the important people in their lives that they want to carry on looking after? Because knowing those sorts of things really helps you understand the person, develop rapport, but also highlights the importance of preventing poor health in the future. It's very difficult to look after the people you love if you've had a stroke, for example. So those sorts of issues about what people love doing as well as what their problems are is really helpful. The other thing that came out of some of the work that the college did, and from Jeff Sperling, who's a fabulous GP at Inala in Queensland, and he did a PhD which essentially asked communities, so what's important to you in health assessments? And he was expecting it to be about maybe weight, or maybe alcohol, or maybe smoking, or all the biological markers that we're well used to. And actually, community members said, we want you to understand us better. We want it to be an understanding of the circumstances that we live in. We want you to know when our housing's no good. We want you to be able to help advocate when there's, say, legal problems going on or something, advocate on our behalf with, or understand when we're experiencing racism. And so these broader, what we term social determinants of health, were an important facet for community of understanding what was important in a health assessment. Is that something you'd recognise, Chris?
Definitely, most definitely. I think that understanding people's backgrounds when they come within your service and stuff is really, I think it's crucial to that relationship, as it's always said, but also understanding that to make better health choices for themselves as well, or developing that.
So, and it allows us to develop much more effective plans with people when we know the circumstances that they're living in. If we move on to the next slide, this is one of the things I've become really aware of, I think, is when people are saying, oh, you must do more health assessments, and the pressure is always on to do more and more health assessments. Because it's the doctors billing the health assessment, it looks like it's just something that you just need to tell the doctors to do more of them. And one of the things that I became really aware of is how much of a team approach it is. So, for example, thinking about the patient journey through the service, flagging the eligibility for a health assessment, so they haven't had one done in the last 12 months or 9 months, and flagging that they're eligible, and then having patients might be invited by reception for health assessments when they're there on the day, if there's capacity in the service. If nurses or health workers are aware that someone's eligible for a health assessment or it's coming due, they can start raising that, discussing it with the patient, what's important to them, and start gathering some of the crucial information. And then who in the service is ensuring follow-up visits after the health assessment to ensure that they're effective, and in coordinating all of that, and with the increased awareness that we might see from the Your Health, Your Future work, organising that in terms of the capacity within the service to see people for the longer appointments that's required, for the planned follow-up care, and seeing people for the appropriate length of time, thinking about it as a system within the service involving multiple people, actually makes them more effective and makes the service able to do them rather than always just seeing the problems that people are presenting with at the time. Anything you'd add, Chris?
No, I think using a team approach, and it's like, so they're saying, what is it, a village sort of thing,
Yeah.
instead of just that one. It shouldn't be on one person's shoulder. I think that when you work in Aboriginal health, it has to be a team approach, and I think when you see it in operation, it works really well when you've got a great team around you.
Yeah, and again, the Aboriginal health workers are crucial in part of that, because they understand what's happening in the community. They can often say things to patients that I could never get away with saying, about getting people back into the service as well. And I think the other thing about team approach that stems from the rapport that someone in the team has with the patient is that rapport could be transferred. So there's something about working in a service that says, hey, we've got an optometrist here. It would be lovely to get your eyes checked. Come with me and meet Miriam, our optometrist. And then you can actually introduce them in the service, and it's much less anonymous than just the I'm going to refer you to this specialist or this allied health person, and that can be really helpful at sort of spreading the trust through the service. If we move on to the next slide, again, we've stressed this several times around the importance of follow-up visits. And just invitation to pause here and invite you to put into the chat box the sorts of, are there any particular strategies that you've found useful in your services to making follow-ups for health assessment become more effective? And I think one of the advantages we have working in the community control sector is that the social determinants that we were talking about, we often have methods of getting around that at a local level. Someone's commented transport and home visits are really important, and I know that many services offer transport because that's crucial for getting people to where they are. Even in the city where we work, the public transport around the service is pretty poor, and transport's a crucial thing that we offer. Any other thoughts from people about how they've helped in terms of getting follow-up visits working?
Tim, it's Lee here. I can just say that just from some of the engagement that we had from our face-to-face Your Health, Your Future collaborative meeting, that the clinics are thinking about how smart they can be and how that they are like, such a terrible word, but process a patient or a client, and how they can have some sort of methodology to how they get the whole assessment done in one sort of visit. So I think that if people wanted to sort of have a conversation with us or ask us about some methods on how that's something that we could actually look at and give those people some advice. But we have, I'm just saying that there are really some structured ways that can improve things.
Absolutely. And someone's mentioning mobile clinics there as well. And I think these are imaginative ways of reducing the gap between patients and the service to actually get there. I think one of the things you mentioned, Lee, was about the continuous quality improvement methods that are actually really useful at improving some of these ideas, because every service is slightly different and works in slightly different areas. And so the ideas are often quite specific to local areas. So we've got some other comments coming in. We offer patients the opportunity to tap into other projects like a fruit and vegetable program, weekly box, and Go for Fun, plus exercise programs, and do giving merchandise after the health check. Oh, that's right. So I think that's a question. Does giving merchandise after the health check, such as T-shirts and things, discourage clients on the long term? That would be a good research question if anyone wants a PhD to do. We book the next appointments prior to them leaving, and we have 2 brilliant transport drivers who know the community well. And again, that's an importance of the whole team approach.
Yeah, I think the one that I seen that worked really well is having some of the like the workers in the community, health workers and stuff in the community, would come out to the to reception area, sometimes into the waiting room, and just go around and talking to people and creating a really friendly atmosphere for a conversation, stuff like that, where people would come, especially the elderly people, would come and have a conversation. I think just creating that, you know, it's not such a sterile environment or a quiet place, but somewhere people can actually have a bit of a conversation as well.
Absolutely. Certainly in the waiting room I work in, often I'll call people in, but they'll finish their conversations off with friends, and they'll greet people as friends as we're going back down the corridor, because it is a very social environment. If we move on to the next slide, it's sometimes useful to think about the issues as for strengthening follow-up. And actually, there's the MJA in 2000 had a paper called Follow-up of Indigenous Specific Health Assessments, the sociological analysis, and they were able to split things up into these 4 levels, where there were things about the patient level, things about the patient that made it hard to follow up, and I guess some of those are issues around transport. The interpersonal level, which is about the rapport and whether people had a good interpersonal experience with people. Things that can be done in the health service itself, so that's around the team approach and the management level. Things that happen in the community outside the service, and I think Your Health, Your Future is very much able to work at that health service and community level. Would that be fair to say, Lee?
Yes, I think it is very fair, and I think that the nature of the relationships with communities and members is really important. I think that often too, community members see like risky behaviour, and they can highlight certain things and bring things to certain people's attention and have those conversations quite fluidly and easily, and also pass on good experiences. So I think that's really important.
Absolutely, and certainly word of mouth about good experiences that people have.
Absolutely.
Is really important.
That Koori grapevine on that radio, it's absolutely really essential.
Make you or break you.
Yeah. Chris, say that again, Chris.
It can make you or break you.
Yeah, absolutely. And I'm really aware of that, even for those. I'm aware that I've been tested out a few times with minor complaints over a few consultations to see if I can be trusted with the major thing that's really worrying people. And so again, that's an opportunity for health assessments to be used as a way of saying, look, I understand the experiences you've had in other health systems, other health services. That won't happen here. We're aware of that, and we'll go out of our way to make sure it doesn't happen as far as we can. So if we look at patient level strategies, obviously these aren't exhaustive, and I think they're not applicable exactly as is in each service. It's not one size fits all, but these are the sort of examples of patient level ideas to strengthen follow-up, again from this paper from the MGA. So we've already talked about transport and other barriers to follow-up care, so actually just getting them to the service. As one of our comments said, we have 2 brilliant transport drivers who know the community well. I often think if you want to know what people really think about the service that they've had, the drivers are the people who will know, because people will talk on the way home in the car. And strengthening connections between health services and local communities to enable recall of patients who require follow-up. So that's often around people who know the patient well and their circumstances, as well as the, say, IT systems in the service. So will people respond to a personal touch or a visit from the Aboriginal health worker rather than an SMS from the computer system? And again, those can only be decided through knowing patient preferences and won't be the same for everyone. Anything you'd add to patient level barriers, Chris?
No, you're right. Sorry, Tim. Okay. I'm just thinking of the age groups and understanding of technologies too. Like that.
Yeah, that's true. There's so much wants to move online and use technology, and I think that's good, particularly around particular age groups. But there's still plenty of people who struggle with that, or access to that, or we often can't assume the literacy levels required for online access either. There's been some interesting research by Louise Stone on that recently with e-mental health resources showing that the literacy levels required for that are actually way higher than many of the people who would need them actually have. Anything you'd add to patient level follow-up, Lee?
Yes, I was just going to say that a lot of patients might have actually had an S715 health assessment done and they're not aware of it. So, and that really falls back to the way that we can, we talk about the 715 health assessment and what it is. And, you did talk about revenue making in the beginning about how, they can be quite lucrative for an AMS, but they can, and, I worry that they might be getting done in some ways, and people haven't been, been explained about the importance of why they're happening, why they're being done today, what it looks like, consent. So I just think that whole open communication and why they're doing it is really important. So people need to be able to have that consent. I totally agree with you.
Absolutely, it's a really important point, because if the patients don't know they've had one, they haven't had chance to consent, and actually that's one of the requirements for billing Medicare. Chris, you wanted to ask something.
Leah, I just want to know, will you be putting out like an info commercial around the health check, around the health check itself, so they could play in AMSs? Is that a thing? I'm just wondering.
Sorry, Christine, did you direct that question at me?
No, I'm just wondering if there's going to be like an info commercial sort of thing to put in AMSs, because some AMSs have like TVs in their reception and stuff like that, and just to talk about what a health check is and what does it mean for them and things like that. Is that a possibility in the future? I'm just...
Look, you're absolutely right. I think there are absolute opportunities to use technology. HitNet is something that is in a few of our services, and we could look at doing an info commercial on HitNet, for example. But we could definitely have a look at different processes. There's some of our member services, like a Wobble, for example, have patient education videos in their waiting rooms. Redfern AMS does actually have videos in their waiting rooms as well. So it's the type of thing that we could actually start doing that. We could use some of the footage and some of our ambassador collateral that we've been using to actually design a video about the health assessment. We were going to look at designing a video with Jack Wilson, actually getting a 715 health assessment, and using that video as a clinical tool, but also as a patient tool.
Yeah,
that's good. We're getting support from the audience. So not only is this a educational webinar, it seems we may have actually got policy outcomes from it as well. So that's marvelous. If we move on to the next slide, this looks at the interpersonal level, and so again, to some extent, that's around personal health practitioner cultural competency, however you want to use that terminology, and that people have that. I think we often as clinicians think about cultural awareness, cultural safety purely as an interpersonal thing, but it's actually much more. It's also requires organizational and governance support for cultural safety to happen, not just interpersonal. But interpersonal is clearly important in the way we interact with our patients. Now, as GPs, that's the core of what we do. It's part of our core training, is doing this well. And I think I'll invite everyone after the webinar. We've said about how important rapport is, and I think everyone knows that, but then the next step is, okay, what are the actual steps we take that allow rapport to develop, to actively develop rapport, rather than just know that we should be doing it and then wondering how accidentally we should make it happen.
Yeah, I absolutely agree with you, Tim. And when our students start returning here to our campus here in Little Bay, we will be including in their training sessions the importance of 715 health assessments. So we will be teaching even our students who are coming through the importance of promoting 715 health assessments with their clients that they'll be going back and working with in the AMSs.
Excellent. We've got a question come through, which is a really important one. Can the information be transferred between practices? Because many Aboriginal people may attend different services to access healthcare. That's one of the important questions that came through in the NACCHO RSCGP work around effective health assessments, is the importance of the IT and transfer of information. And actually, it can't be done very well. So the way it's done at the moment is through letters and PDFs, so it requires a human brain to interpret, but it doesn't bring across information in a computer readable way, like HbA1c, like blood pressures, like coded medications or coded diagnoses. And there are lots of projects looking at doing that around the sharing of information effectively, and actually the Aboriginal Health Assessment is going to be their sort of proof of concept that that's what they're going to use as a defined set of information to work out how to do this. So it'll be really watch this space, I think. My health record, I think, is being used probably increasingly, but is at a really early stage, and again doesn't have things coded. It's all in documents. Be good to have another 715 education on how to improve content. We shall take note of that, and we can organise others. If we move on to the next slide, strategies. This is the community level, and again, this is where Your Health, Your Future comes in, particularly, where just the sort of there's the pull factors in the service, I guess, that get people in using recall systems and things like that, and say you're invited to come back in, and Aboriginal health workers inviting people to come back in. But there's also the push factors of awareness in the community, where people are discussing among themselves health issues that they have, which we know happens, and recognizing that there's early interventions for those that can keep people well by attending health services. Chris or Lee, anything that you'd add about community level? I mean, I remember one of the first things that you ever said to me, Chris, when we started thinking about these things was people in communities know what's happening to them. It's not that they don't know they're sick and things. So that actually there's this, when we're thinking around health literacy and people's knowledge, we're not starting from an empty page. People know a lot about these conditions because they've seen relatives and friends with the consequences of the problems that they're seeing.
Which really brings me around to that health literacy after, I think, and how we get that message across. And I think we tend to put out like posters and prints, and sometimes that we must also remember that some people can't read, and so having, I mean, I'm really in for the visual stuff at the moment too. I think that's the way to go. And there's been some research around, when we talk about health literacy, people think it's about not understanding medications, but it's a little bit more deeper than that.
Absolutely.
Yeah.
Absolutely. Anything you'd add, Lee, about, and particularly around Your Health, Your Future and how that works at community level?
Yeah, I mean, I think the success with Your Health, Your Future is that they are the collaborating members are doing projects based on their community needs. And I think that that's a real strength so they're doing focuses on things that they think is really important, or that they're getting feedback from their AMSs or from the community. So it's really that they've engaged the community. So that's just about then the community saying, well, they've obviously listened as well. So I think that improves the experience. I would like to think that if being a nurse myself, whenever I was doing patient health assessments on people and talking about family history, and if somebody had a family history of a disease or an illness, making sure that that we have that conversation with people about, do you have any children? Do they have any risks? Do you see, that the diabetes might be a problem in their family? Like if you've got a mother, like if you've got a young girl who's going into is pregnant, and they might have had gestational diabetes before, and just having those conversations, and that's really about just getting to know who you're doing a health assessment on. And I think that those are the real important factors that we try to make sure that we keep records of and document as well. Particularly, obviously renal is a real problem. Just worries me, renal. But anyway, what are we going to do? But those histories are really important.
Absolutely. Yeah. And I think renal's a really good example. I think the other two levels were the health service level and the policy level. And if we move on to the next slide, they sort of combine a little bit in thinking again where we started from, the environment that we're sending people back into, the social and cultural determinants. And it's one of the advantages we have in Aboriginal medical services is that many of the GPs are often reluctant to ask about social determinant sort of questions in health assessments, because we often feel there's very little we can do. If we find out about poor housing or about food insecurity, there's, particularly in mainstream practice, there's very little that we can actually do about it. And there's a bit more that we're able to do about it working in the Aboriginal medical services, because it's more than just a medical service. So we've already heard, and our service does this too, subsidised fresh fruit and vegetable boxes, which are really popular where I am. And there's some research from several years ago in the MJA suggesting that doing that produces good health outcomes. And so it's not that people are choosing not to eat well, it's so frequently an access issue. And similarly, there's Aboriginal community controlled health organisations often have good links into housing departments in New South Wales, and being able to help people and advocate within housing for doing that. And we're seeing examples of health justice partnerships increasingly, which allow access to legal services that really impact on their health as well.
See, I also think that what's missing out of that is that social factor as well. I think linking people into good support groups within the context of your AMS or community can actually help people benefit their health as well. I
Absolutely.
think, thinking, and also people who maybe there might be someone in the community that, they could talk to about the similar stuff if that's the thing. I think that we don't, as AMSs, we don't do very well in open up the dialogue around our health, and actually to say, what does that mean to look after oneself, because we tend to look after everyone else before we look after ourselves. And I think that's something that it's coming quite being aware of mindfulness around it.
Yeah, that's certainly right. And so, and then the other area, social and cultural terms, are often determined by policy and policy areas and policy around health services as well, which we're not going to go into because it's areas that we can take part in as advocacy from the community control sector and from the college, but it's not so much part of a health assessment. The next two slides have some useful resources, and if we send out the slides, you'll be able to have a check on both of those. They are hyperlinks that you can click on. Also, keep an eye out on the college website, because as a result of the project that we did joint with Nacho, there will be other resources come out from that. Some of them already out, like results of the roundtable discussion around health assessments. There will be some templates around the content of good health assessments, and that again would be, as someone suggested, a good topic for another webinar. We've reached 1:30, so I'm really aware that you'll all be in busy services. We'll send the slides round to you. Chris and Lee, any final comments before people carry on with their regular day-to-day work?
No, I'm right.
Nothing more for me.
Yep.
Lovely. In that case,
Nothing
thank you very much for joining us. if people have any questions, feel free to send them through, and we'll do our best to answer them. When you leave, you'll be taken to an evaluation page, and we'd love to have your evaluations from this lunchtime webinar. Really appreciate you joining us today. Thank you to Lee, and thank you to Chris for helping out so well, and thanks to Sammy for running the IT so smoothly.
That's
Fabulous.
great.
Thank you very much, everybody.
Wonderful.
Thank
And
you.
just thank you again to Tim, Chris, and Lee, and to everybody who joined us online. We really hope you enjoyed the activity and look forward to your feedback. Thank you and goodbye.